Memory loss can be frightening and frustrating, whether it's simply a sign of aging or the complete decline into dementia. Tonight we'll be talking about dementias, such as Alzheimer's disease and memory loss, and how to seek help in dealing with loved ones. My guests tonight are Cindy Keith, a registered nurse and a certified dementia practitioner. Cindy teaches nurses, nursing assistants, and support staff about the best way to care for patients with dementia. Also joining us is Jane Sheeter. Jane was very active in her mother's care at a nursing home, which she found very challenging. But she was able to work with Cindy to come up with strategies to make her mom's life more calm and happy in the nursing home. We'll talk about her experience, but we also want to hear from you. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're here to take your phone calls and answer your questions about memory loss. Call us at 1-800-543-8242 to join in the discussion. To start things off, I'd really like to ask Cindy about Alzheimer's, memory loss, and this whole notion of dementia. Isn't it true that dementia is really the broad umbrella term that we use to describe diseases such as Alzheimer's disease?
You're absolutely right, Chris. It is. If you can think of dementia as the umbrella term, Alzheimer's is the most common type of dementia. 50 to 70% of dementias are Alzheimer's. And there are probably over 40 different types of dementia out there. Now, most of them are pretty rare, thankfully. So when you hear dementia, you think of that as the umbrella term, and Alzheimer's is a type of dementia.
And you're a certified dementia practitioner.
Yes.
How do you operate as a practitioner working with individuals with memory loss?
Well, I have my own business, and it's called Mind in Memory Care, and MIND stands for Moving and Nurturing Directions in Memory Care. And what I do is I help families. I consult with families who are dealing with a loved one with some form of dementia. I can tell them how to keep their loved one safer in the home, what behaviors they might see with this type of dementia, and what's most important, how to handle those behaviors without escalating them, and what resources might be available to them. Things like that. I also do staff teaching in facilities, and I have a training video that I've created.
Okay.
So I think it's essential that staff are trained how to properly care for these people.
Well, you have a relationship with Jane, and that relationship really began because Jane contacted you to be part of a team to work with her mother. Is that right?
It is, and I think that that's essential in terms of working with these families that Cindy works with, whether your loved one is in a retirement community or whether she or he is in a home, that you are a team. And I know the patient well because the loved one is a member of my family, whereas Cindy knows a lot from her experience. So it's important to get both those opinions.
It is.
Jane, your mom was in a retirement community. Mm-hmm. When did you first realize that she needed assistance with, or you needed to get assistance to deal with her because of her memory problems?
Well, there were many little tiny things that happened that I needed to kind of connect. One thing was several of her friends had stopped to pick her up for events, and she had forgotten. There'd been a slight fall down a few cellar steps. And then as I took all of those little things, and I have a sister, she also noticed some of those things, we began to put some of those things together and talk to my mother about it. Mm-hmm. She was in a home that she had been raised in. So this was going to be difficult, we knew.
Was it quite a sad recognition that things were changing?
Yes, a sad recognition, and a person hates to hear that they're not quite what they were before, and there's a lot of struggle to exert that independence and kind of a fierce feeling of I'm no different than all the others around me who are aging, etc.
Well, at what point did Cindy get involved? to help you?
My mother did move to a retirement community, and Cindy was on the staff, and so it was real important, I felt, to have help with just certain days in terms of dealing with my mother.
What kind of help, Cindy, do most people need? What don't we know about dealing with a loved one that may be experiencing memory changes in front of our eyes?
That's a difficult question to answer, in that you have different levels of the dementia, whether it's Alzheimer's or whatever type of dementia it is. When I first met Jane's mother, she was in the late stages of her dementia, and it was very challenging to care for her, as it is with anybody in the late stages of dementia. They become very childlike, and their world is reduced to just their immediate surroundings. And if you don't interact properly with them, you're not going to be able to get them to do what you want them to do.
What do you mean, treat them properly or act properly? Can you give us an example of what that really means?
Well, a good example with Jane's mother was that she hated to be cold.
Mm-hmm.
And if you didn't recognize that and work with her, you weren't going to get anywhere with her.
So what would she say to you?
Well, one of the things, of course, was always this, which was a death grip. And if you tried to get anything on or off, you were locked out. So you had to devise many ways to give her the message that we were going to help and we were trying to make it better, and talk about something else, or I often sang with her. So we would be singing a song and trying to take off or put on. So
is that a distraction strategy?
It is. And that's extremely important when you're working with people with dementia, is to try to get their mind, their impaired mind, onto another topic, to avoid them thinking about what you're trying to do with them or to them. And singing was often the only way that we could get her mother to release that death grip. Mm-hmm. And a gentle touch, and keeping her warm.
Mm-hmm. So do you think that most people, if they still have a loved one in their home, or they are working with their loved one who may be having some memory difficulties, do you think it's more traditionally quite a struggle? Instead of doing positive, distracting behaviors, we argue with them and try to get them to see reason?
That's very, very true. And it is so difficult, because if it's your spouse that has the dementia, you likely have a relationship with this spouse that you've had for many, many years, a way of interacting with them, of arguing with them, of everything. And it's difficult to just let them win. Mm-hmm. All of a sudden, you have to just always let them win, unless it's a huge safety issue. If they want to believe that today is Saturday, let them believe it's Saturday. It doesn't matter. In the end, they're going to forget it anyway.
Okay. We're going to take a call from Jim in Lock Haven. Hi, Jim. Do you have a question for us tonight?
Yes.
Go ahead.
I'm close to 60 years old right now, and seem like I've been forgetting things an awful lot lately. I mean, people my age, like I said, I'll be 60 in July, say that, oh, that's just your age, and I do the same thing. I forget this and I forget that all the time, you know. And I said, but it seems like I'm doing it an awful lot lately. Now, I am a hyper person. I play drums and involved with music, I think I react to things pretty quickly. And like, I'll give you a small example. Like, I made a bunch of tapes for some guys here that I belong to a group, and I wanted to give it to them before Christmas, and I kept forgetting it. They were done for almost a month and a half by the time I finally got it to them, and that's just a simple thing.
So you're actually...
Like I'm forgetting simple things.
You're actually concerned about yourself and whether or not these forgetful behaviors are really a sign of something more serious. Is that right?
Yeah,
Cindy, would you say that what he's described is something to be concerned about?
My first reaction to a healthy adult at around the age of 60 who's complaining about some forgetfulness, such as Jim is that it's probably stress related. You probably don't realize how much stress you're actually under, And I think that if you can go to your doctor and say, you know, I've been forgetting these things, could you just take a few blood tests and rule some things out? There are so many different things that can mimic a dementia, that can mimic Alzheimer's. Stress, depression, vitamin B12 deficiency, a true vitamin B12 deficiency, a thyroid disorder. Those are just a few of the things that could mimic something like Alzheimer's. And usually, at the age of 60, that would be a little bit early for you to be starting into a dementia, but it's possible, but it's probably not likely. I think the chances, given your age group, less than age 64, your chances, according to the Alzheimer's Disease International, say that your chances of having Alzheimer's or dementia are about 1 in 1,000.
Okay.
So.
That's good to hear.
One of the things that I just heard you say that is really fascinating, we probably oftentimes think of dementias, particularly Alzheimer's disease, as merely age-related. And yet it could be caused by some of the other things. Or you said we have a lot of situations, environmental stressors or things like that, that may mimic Alzheimer's or other dementias. How frequent do those things actually plague us?
Well, if it is caused, if the dementia is caused by one of those things, like a B12 deficiency or a thyroid disorder, then that is not a true dementia. That is a reversible form of dementia, so to speak. If you have a dementia, the biggest risk factor for getting a dementia is actually age. Again, going back to the Alzheimer's Disease International, from the ages of 66 to 79, your chances are 1 in 20 of getting a dementia. From the ages of 80 to 84, your chances are 1 in 5. And after the age of 85, your chances are almost 1 in 2.
Oh.
So age is the biggest risk factor. That's not to say that you can't get it sooner, but.
If someone thinks that they are really experiencing severe memory changes, at what point should they act on it because of fear or danger to themselves?
They should act on it immediately. They should go to their doctor and say, look, this is what's been happening to me. Because the earlier you can get that diagnosis, as difficult as it will be to hear that diagnosis, imagine how relieved you would be if it's not that, if it's something that you can fix. But if it is a diagnosis of a type of dementia, then you have some time to make some decisions, some healthcare decisions, and make some plans with your family. Getting a durable healthcare power of attorney appointed, that is so crucial.
Can you talk a little bit about what that is, a durable healthcare power of attorney?
That is a document, a legal document, where you would specify a person or more than one person close to you that you trust, that in the event you can no longer make your own healthcare decisions, that person can legally make those decisions for you. It can be as important as having a breathing tube removed. Okay. So this person would have to know your wishes, and you would have to trust this person implicitly.
So Jane, your mother was not involved in any decisions about who she wanted to work with when she was in her retirement community, because she was in an advanced stage. Is that correct?
Yes, and it was the staff that were there daily attending to her.
You referred to earlier as a team approach to working with your mother. Did you bring in people besides Cindy to help deal with your mom and just help distract her, more or less?
I did, especially people that could sing. But in one case, this woman could speak Russian, and she often recited poetry to my mother in Russian, which was a wonderful kind of difference in her life. But the most important thing was for the people that were around me and for me to have good communication skills so that we could talk about what was happening. Were things getting any better? Were they getting worse? Was the deterioration at a new level, and then we could talk about whether we felt the food needed to be changed, or she needed more activities, or needed to be up and about more, or sitting more quietly. Those things all needed to be really talked out, I felt, in terms of all the people that I worked with, so that we all did somewhat the same kinds of things. I think that's very helpful to these people.
We actually kept a log.
We did.
For her mother.
Yes,
Things
we
that we
did.
did with her that worked
Absolutely.
or that didn't work.
So Cindy, you didn't just work with Jane's mother, you
No.
worked with Jane also.
I did.
And so
Sure did.
a certified dementia practitioner really is working in this bifurcated way where you're working with the family and you're working with the patient. And what I'm interested in knowing is, working with the family, is there resistance to help them recognize what needs to be done? Is it almost like grief counseling in a way, because they're in a way losing
Right.
a part of their family member that they can't get back?
That is one of the reasons I became a certified dementia practitioner. I was working closely with families mostly. I did work with people with dementia. I love people with dementia, and I love working with them. But I realized that I was spending more time with the families, and I was able to help them through these extremely difficult times. These families are watching their loved one die one brain cell at a time. And the person with dementia will likely reach a point in their dementia where they're fairly comfortable. They don't realize they have dementia anymore, and as long as you're not making them do something they don't want to do, they're fairly content. But it's the families that continue to suffer on a daily basis. So that's what I try to do, is get across to the families that there are ways that you can make your life better as well as that person with dementia.
Okay. Well, we're going to take a call from Dick from Johnstown. Hi, Dick. How are you?
Thanks for taking my call.
You're welcome.
I was curious to ask the nurse practitioner. I think she cited after age 85, there's a 1 in 2 chance of having dementia. And I was curious as to what other diseases, speaking specifically of cancer and heart disease, might also approach this straight line relationship. And that certainly is not to mitigate the effects of Alzheimer's, but it seems to me that the advancing age, there's so many things we can get. It seems we're going to get one of them when we reach this age, and I would just like her to comment on that. Thank you.
Well, Dick, I'm sorry I can't give you statistics on that, because I don't know what those statistics are. As I said, that after the age of 85, the chances of a person acquiring some type of dementia are almost 1 in 2. I think they're currently at 1 in 3, but as this whole group of baby boomers begins to age, that's going to edge into 1 in 2. And you know, I've known a lot of people who are in their 80s and 90s and even hundreds who are fairly healthy and they don't have dementia. And I just like to take the philosophy that, well, I'm just not going to get any of those things. So I'm just going to live as if I'm going to live forever. So.
And be happy and have high quality of life.
Yes.
Yeah. If you're just joining us, this is Your Health, and we're inviting your calls. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're talking with Cindy Keith, a registered nurse and a certified dementia practitioner. Also joining us is Jane Sheeter, who was very active in her mother's care at a nursing home. Tonight we're talking about dementias, such as Alzheimer's disease and memory loss. Call us with your questions at 1-800-543-8242. Well, we've been talking about Alzheimer's disease, memory loss, and some of the things that people can pay attention to see maybe if someone that they're close to is experiencing this. What I want to know is, from a prevention standpoint, there's been a lot of studies and a lot of research into, can this be prevented? What are some of the things that we know we can do as we're aging that could help stave off memory loss?
There are a number of things that we can do. probably one of the biggest things that we can do is to stay active, not only physically, but mentally active. The Alzheimer's Association has a great program called Maintain Your Brain, where they talk about a lot of different things also. But another very common type of dementia stems from small strokes in the brain. That's called multi-infarct dementia. And the way that you avoid getting that is to not have strokes, which means you clean up your diet, you exercise, you keep those vessels clean. That's a big thing because as the baby boomers age, the studies are showing that we're not going to stop having strokes anytime soon, so that type of dementia is going to continue to increase. Just doing things in a different way. They say crossword puzzles, those Sudoku, things like that really help to...
Learning new things.
Exactly. Learning a new language, that type of thing.
Okay.
That all helps.
Great. Okay.
Eating well.
Yes,
You
diet.
want to put
Sure.
that-
Absolutely. We're going to take a call first from Millie from Falls Creek. Hi, Millie. Are you still there? Oh, okay. I'm sorry. Then how about Cynthia from Warren?
Hello.
Hi, Cynthia.
Hi.
Do you have a question for us tonight?
Yes, please.
Okay.
My biological father, I was told, died of Alzheimer's in his 70s. And since I inherited some other diseases from his side of the family, I was wondering, what are my chances of getting Alzheimer's?
They say that your chances will be a little bit increased, just a little bit increased, if you have a first-degree relative who has had a type of dementia like Alzheimer's. It's not that great. Again, I prefer to think positively and not worry about it, because stress is going to mimic a dementia and it's going to make your life miserable. So I'm sorry I don't know the exact numbers for that inheriting a type of dementia like that, but it's not great.
Well, thank you very much.
You're welcome.
Thanks, Cynthia.
I appreciate the information.
Okay, thanks
Great
for calling.
show.
Thank you. So the likelihood of inheriting a dementia isn't probably as high as we otherwise think. We pretty much think, okay, my dad, my mother had cardiovascular disease, I'm probably going to be a little bit higher risk. Diabetes, we certainly know, is a heredity-based disease, and dementia may or may not. And like you said, physical activity, mental activity may actually help ward these off. And have you read any studies about what specifics about diet makes a difference in dementia, such as weight? Does weight make any difference that you're aware of?
I'm not sure. I don't recall reading any studies about weight making a difference, but it all ties back into that keeping your vessels clean, keeping your cholesterol down, because you know, if your weight is up, it's likely that your vessels are going to be occluding at some point. You're going to get multi-infarct dementia. As a matter of fact, with the American diet, you probably have to worry more about getting a multi-infarct dementia than Alzheimer's, you know, inheriting Alzheimer's. So I don't know about studies as far as weight affecting dementia, but again, diabetes, that is going to be closing off some of the vessels in your brain and making you more confused and probably...
So generally, do whatever you can do to maintain a healthy body, and both physical activity, mental activity is going to play a really key role.
Exactly.
Well, we're going to take a call from Tom in Punxsutawney. Hi, Tom, are you there?
Yeah, I am.
Can we answer a question for you tonight?
Well, sure. I was wondering about you know, a parent, about 85 or 83, around that area, and you know, she has short-term memory loss, and we were wondering if she doesn't remember, in the course of a conversation, you know, who she talked to, or if you mentioned where, you know, where's Joey, and well, he's in college, and 5 minutes later, well, where's Joey? And well, he's in college. Somebody like that, who otherwise seems fairly healthy, are they better off living with say, one of their children in a family situation, or would they be better off in a nursing home that would have like a Alzheimer dementia care?
That's a really tough question to answer, Tom, because every family situation is different. Mm-hmm. And if this is your mother and you love her and you love having her around, and it doesn't make you go crazy to answer the same question over and over again 50 times every day, then she's most comfortable living in what she's most familiar with.
Okay, that's what we thought.
Yeah, and so if you can do that, that's fine. 7 out of 10 people with dementia currently live at home. That's a lot of families taking care of a lot of people with dementia. And every time you take a person with dementia and put them in an unfamiliar environment, it's going to cause a lot of stress on that person. They will become adjusted to it eventually, but the more you can keep things the same for them, the better it is for them. But you can't do it at your own expense or the expense of your family. You have to take that into consideration.
Well, that's what we kind of thought, because you can talk about her memory of the past is real great. Of course, you can hold a conversation with that. And we were thinking, like in a nursing home, why nobody would know who she's talking about.
Right. I say go into the past with her.
I agree.
Bring those memories up and just relive them with her, and just remind her how wonderful they were. Keep the photo album out on the coffee table so that if she's becoming restless or she can't settle down, you can get that photograph album out and sit down and start looking at it. And try to avoid saying, do you know who this is? Or do you remember who this is? You instead use sentences like, I remember when Betty did this. And if she remembers, she'll follow along with it. And if not, you go on to the next picture.
Oh, yeah, we've been hearing some great stories from years ago.
Wonderful.
Good.
That's great.
Record them.
Yeah, record them.
Keep her at home as long as we can. Huh?
Good for you.
I agree.
All right, let's take a call from Ellen from Blandburg. Hi, Ellen. Are you there?
Hi. Yes, I'm here.
How can we help you?
I just was wondering, my husband, we took him to the hospital on September the 3rd. September the 10th of 2005, he died, and the doctor said he had dementia. Up until we took him to the hospital, he knew us all. He knew what we were talking about. And from the time we left the emergency room to take him to ICU, he didn't know anyone. And that's what the doctor said, he had dementia. And I still can't understand why it went so fast.
Ellen, do you know why he went to the hospital in the first place?
Yes, because his bed. I got up on Saturday morning and I said, Paul, your bed's all wet. And he said, no, it's not. I said, yes, it is. I said, it's not my side. So I called my son-in-law down because I didn't know what to do. I knew I had to get him to the hospital because I knew he couldn't lay in a wet bed. And I told him, I said, we have to take you up to the emergency room to get you, so we can get a hospital bed and get you in a dry bed. He didn't say anything. It was fine. We took his sugar, which was on our machine, it was 600. When we got him to the hospital, it was 1,200.
Oh, my.
Yeah.
But from the time he got on the cart to go to ICU, he knew me. He kept telling me, Ellen, I want to go home. I can rest just as good at home. And I said, no, not with your sugar this way. But till we got to the ICU, he didn't know anyone, and not a person he didn't know. He didn't know me.
Yeah.
He didn't know his daughter. He didn't know his son-in-law. He didn't know any of us.
Well, Ellen, without knowing all of the details of that illness, it just sounds to me as if he had a lot of other things working on him besides dementia. And he may have actually had a dementia, a very early stage dementia that he was entering, but it sounds like he was also having a lot of metabolic problems with the sugars and so on. And that is likely what caused him to die.
And I couldn't figure out why he lost all memory of us.
Because the sugar being that high alone would cause changes in the brain that...
Well, they got his sugar
yeah.
back down to around 300 within this Saturday.
Yeah. It's really hard to say what caused those changes in the brain, but that's where it all takes place, is in the brain.
From his sugar then.
Yeah, that's probably was what started it.
Uh-huh.
But
Ellen, thanks so much for calling.
You're welcome.
Thank you so much.
And thank you for answering my question.
You're welcome.
You're so welcome. Let's take a call from Susan in State College. Hi, Susan.
Hi.
How are you tonight?
Oh, I couldn't hear you.
Okay.
I'm great. I have a quick question.
Sure.
I'm wondering if my dad's 75 and he was recently in a car accident, and he's not just a fender bender, and suddenly he's fearful and he's just totally changed. And we were starting to think, wow, I wonder what's going on. Is this a sign of dementia? And I'm wondering if, like, post-traumatic stress could mimic dementia.
yes, I think it could.
Okay.
I think it could. And I think that if this continues for, a week or so more, that you should talk to him about possibly going to the doctor for some tests. And if he does have post-traumatic stress, maybe he can get on a very low dose of a medication that could help with that.
Mm-hmm. Okay. Just listening to your show made me think of this, actually. So thank you so much.
Good luck with him.
Thank you.
How about a call from John in Warren? Hi, John.
Hello. I know what the future of Alzheimer's care is. Can you hear me?
Yes.
My mother-in-law was starved to death under judicial order in a nursing home because she was diagnosed with Alzheimer's.
I guess I may have missed a little bit of your question, John. You said your mom is in a nursing home?
My mother-in-law was starved to death by judicial order when she was in a nursing home.
Oh, my.
So maybe that's the future of Alzheimer's care in this country.
Well, that's pretty bleak. Let's hope that that isn't what the future is. And hopefully certified dementia practitioners like Cindy, educating nurses and nursing assistants and staff.
Well, how about educating judges who the judge ordered this starvation plan?
Yeah, that would be, I'm sure that we all can benefit from education. That's really what this show is all about, is it's an outreach program and hopefully an education. So thanks for your call. Let's take a call from Martha in Williamsport. Hi, Martha.
Oh, would you please discuss the cost of caring for an Alzheimer patient in a care facility and if long-term care insurance is of benefit?
Great. I think long-term care insurance is a great idea if you have it. And at this point, many elderly people do not have it because it's a relatively new thing. So all of you baby boomers out there listening to this, you should seriously think about possibly getting some long-term health care insurance. The costs of a person with dementia in a facility, they did a study, and I believe they found that it costs over $5,000 a year more. Now, this study was probably done in 2002. Over $5,000 more per year for staff to interact with a person with dementia as opposed to a person without dementia. And most of that is due to the fact that many people with dementia have behaviors such as agitation and aggression that the staff have to deal with. So it does cost significantly more to house a person with dementia in these facilities, and that's why it's crucial for staff to know how to interact appropriately with them.
Another question is, what is the average lifespan of a person who develops Alzheimer's?
Alzheimer's has an average lifespan of 8 to 10 years. There is really no way to predict it because everyone's different. There's no way to predict how fast it's going to progress. I have seen them go from diagnosis to death in less than 6 months, or they can live as long as 20 years, but the average is 8 to 10 years.
Well, thank you very much.
You're welcome.
Thanks, Martha. We have a call from John in Woodbury. Hi, John. John, are you there from Woodbury?
Yes, ma'am.
Hi, can we help you tonight?
Well, I'm a dom care provider.
Okay.
Well, I'm going to turn my TV down so I don't have feedback. But anyway, there was a couple of suggestions I wanted to give to you and your listening audience. When you get a patient in that situation, a loved one or a relative, take 2 photos of them. One recent photo, full-length photo, and a full-face photo. So if they do wander off, the family can give it to the local police, that picture, and so they know what they're looking for. And now, what is more important, and it's no cost to the family, is Operation Safe Return. It's a program sponsored by the Alzheimer's Association, and believe me, they have some really great training programs. And they will issue a free bracelet. And the one client I have right now, he has a serial number assigned to him, and that number is assigned to me. And if he disappears or walks away, why, if somebody looks at that bracelet, there's an 800 number, and they know exactly. They'll fax his photo out to the local police departments. If you remember here, about a year or so ago, we had a lady that disappeared from the Everett area. Mm-hmm. And they found her car down in Maryland, but never found her yet, as far as I know. But being a dom care provider, you have to give. I set goals for my clients each month. There's to you and I would be very simple goals, but I make them use their brain and keep them active. We go out dancing once a week, sometimes twice a week.
Good for you.
It's just as bad on the caregiver as it is for the client.
Yes.
So these are just some of the things that I wanted to pass on. And Blair County has skills, and Bedford County, where I live, has Area Agency on Aging, and their skills is $1,101 a month. And Bedford County pays the caregiver $859.80 a month. So that's the information I wanted to pass along is to have them registered with Operation Safe Return. I'm going to turn my TV back up so hear your guest response.
Okay.
Thank you.
Well, John, I first want to say thanks so much for your call. That's great additional information. Those are the kinds of resources that we hope all of our listeners can benefit from. And Cindy, are there any other resources that you would like to describe as well as Operation Safe Return?
There are a lot of resources available, and families get so wrapped up into just getting through each day that they kind of go through life with blinders on, and they don't realize that there is help available to them. And if they need help in the home, even if they just need somebody to come in to bathe this person with dementia or just give them a break, a little bit of respite, they can contact agencies, local agencies that do some home care services. There are excellent services in the State College area, such as Gentiva or different home care companies. There are programs out there for learning about Alzheimer's and other dementias. The Alzheimer's Foundation of America, the Alzheimer's Association, they all give different programs. The Safe Return program that he mentioned is an excellent resource, and everyone who has a dementia should be hooked up with that, because Pennsylvania has a grant, has given a grant through the Alzheimer's Association for that program, so it's free to be enrolled in that Safe Return program. So that's a great thing to have for your person with dementia.
And can you say the name of that one more time?
The Safe Return program at the Alzheimer's Association.
All right. Well, in case you're just tuning in, this is Your Health, and we're hoping you'll join the discussion. I'm Chris Clark, Director of Sports Nutrition at Penn State, and we're talking with Cindy Keith, a registered nurse and a certified dementia practitioner. Also joining us is Jane Sheeter, who was very active in her mother's care at a nursing home. Tonight we're talking about dementias, such as Alzheimer's disease and memory loss. Call us with your questions at 1-800-543-8242. We're going to take a call from Kathy in Bellefonte right now. Kathy, are you there?
Yep, I'm here. You kind of answered some of my questions on resources. My mother-in-law had dementia and died, and finding the resources to help my father-in-law out was hard. It was hard on him in taking care of her, and I think that's most important, is for the caregivers to have the support in taking care of someone with late onset. She was like 85 or something and had it for about 10 years. And one aspect was we got in touch with the Office on Aging here in Center County. There's like Home Instead and other outfits out there that can come in your home and give you 2 hours of free time just for the caregiver to get out of the home when they're taking care of someone, because that is a 24/7 job. And so it's important, I think, if you can talk about some of the resources that are out there. And thank you.
You're welcome. Thanks a lot for calling us. One of the things I just want to mention is, Jane, what kind of a relationship can people expect if their parent or their loved one does go into a care facility of some sort? Do you just automatically develop a positive relationship with those staff members, or is it frustrating that maybe they're so busy with many other patients that they simply can't afford the kind of time that a patient with dementia, such as Alzheimer's disease, requires?
I think it's all of the above. It was often wonderful if you had somebody like Cindy to work with and to communicate with, to talk about and have new ideas. And also we were often on the same page, so we did a lot of the same things. And there are many times that it's frustrating, but those were times when I felt I could step in, having known my mother all my life, and do things I knew she liked. I knew she loved music, so I could turn on her radio so that she could listen to classical music or the opera on Saturday afternoon, or at Christmas time I could read some of the old children's books that she had read to us, etc., that a caregiver probably wouldn't know about or didn't have time to do. And I also hired some people to come in and do some of the things that I felt that I wanted them to do that were new that I couldn't do, such as speak Russian. So I think that it's important to step into the hole if there is one. Otherwise, learn from, work with those that are about, and use people like Cindy as resources. They were right down the hall in many cases.
If someone were really at the stage of contemplating finding a facility for their loved one, how do you begin to look for a facility like that?
Well, one of the things I found out after my mother moved to this facility is that very often people that were looking at this facility and others never visited the health units, never went to them and watched the behaviors of the persons there, looked at the rooms, watched what kinds of activities there were for persons, etc. And I think that's a real important thing. And you could certainly inquire as to whether people were willing to accept you as one of their helpers, and were we going to be a team?
I see.
Those are real important things, I think, that I would inquire about.
Okay. Well, I know that a lot of people are very confused about the different kinds and the different levels of care out there. You know, residential nursing homes or care facilities. And it must have been quite challenging to make, first of all, the leap to take your mother out of her home and put her in a facility. That must have been difficult for you as a child.
It was.
But you regret that you didn't inspect the facility and look at the healthcare unit better. Is that what you're saying?
Yes, I guess I learned that as time went along.
Okay.
That would have been something we all should have done together.
Okay. Well, let's take a call from Tom in Lewistown. Tom, are you there now?
Hello.
Hi, Tom.
I wanted to pick up on the point which the practitioner made with respect to B12. About 20 years ago, I had a terrible problem with nervousness and shaking to the point I couldn't drive a car. And then the doctors, after repeated testing, found out my B12 was only about 10% of what it should be. And I would eat the foods that contained B12, but my body would not absorb them. So I got B12 shots 3 a week for 6 weeks, and now I get a B12 shot every month. And I think that's important because ordinarily doctors will not run B12. End of speech.
Were you having some symptoms of dementia that you've heard us talk about on the show tonight?
Yes.
Okay, it's very interesting. And you just weren't absorbing B12, so the injections really made it possible.
My body wasn't absorbing B12.
That's right.
And ordinarily, with a blood test, they won't run B12.
Yeah.
And if you don't absorb it, you have to get it via injection.
Right.
And that to keep you on stream.
Yeah.
It was just a comment I had.
Yeah.
Thank you.
Well, thanks a lot, Tom, for calling in tonight. We have Beatrice on the phone from Warren. Hi, Beatrice.
Hi.
How are you tonight?
I'm fine, thanks.
How can we help you?
I was just wondering if you'd like to speak about the differences between the early onset and general onset and the difference in the progression.
Okay.
Are you just asking about Alzheimer's?
Yeah, mostly. My husband has early onset.
Of Alzheimer's?
Mm-hmm.
Okay.
Yes.
The hallmark sign, if you will, of Alzheimer's is the loss of short-term memory. And in the early stages, that's what families and the person with the dementia will notice first. They just can't remember that they just had breakfast, or they can't remember what this person's name is that they just met yesterday, or they can't remember that they have a doctor's appointment, and so on. Those are the early stages. Then there's no really clear-cut place where they go from early stage to middle stage to late stage. It kind of all blends together. And depending on what scale you're looking at, there could be as many as 7 or more stages to go through. So I tend to simplify it into early, middle, and late stage. They will gradually lose more and more abilities. I call Alzheimer's aging in reverse, because as an infant you gain all of these skills, more and more complex skills as you age, and when you have Alzheimer's you begin to lose some of the most complex skills first, and kind of in reverse order, until you become as an infant again, and that's in the late stages. Did I answer your question?
Somewhat, yes. But I was mostly wondering, too, like the difference in early onset versus the normal of what they would call normal onset.
Okay, you mean getting it at an earlier age?
Yes.
Okay.
Sorry.
The studies indicate that if a person acquires a dementia at an early age, say in the 40s or 50s, that it tends to progress a little more rapidly. Mm-hmm. And again, each person is different. There's really no way to tell how fast it's going to progress. So it's just kind of taking one day at a time and just trying to enjoy your husband while he's still there and you're able to enjoy him.
We do.
Thanks a lot for calling in tonight, Beatrice. And I appreciate your comments. So, Cindy, it doesn't really necessarily have to be a situation. Dementia can occur for a myriad of reasons, but also at a variety of ages.
Yes.
And is it possible that it could actually occur in the 30s?
I think that's quite rare, but yes, it's possible. And they've also discovered that people with Down syndrome are at a much, much higher risk of getting Alzheimer's because we're helping them to live longer.
Mm-hmm.
But it's something like 65% of them after the age of 60 will get Alzheimer's.
Okay.
So.
Well, Cindy, you're a certified dementia practitioner, and you said that one of the reasons you got interested in dementia was actually through your relationship with Jane's mother.
Mm-hmm.
How many certified dementia practitioners exist? I had never heard of it myself before.
It's a relatively new thing. The Alzheimer's Foundation of America is where I obtained my certification. There are some places down in Florida that are now also offering certification in this field because it's becoming more and more common, and they're recognizing the need for this type of education and interaction for families. And yes, Jane's mother was such a challenge, and she was such a delightful little lady that I just enjoyed being able to make her smile and being able to get her to do what I needed her to do.
Mm-hmm. And so if someone were looking for a certified dementia consultant or practitioner, is this something that they look up in the Yellow Pages?
They probably won't find one in the Yellow Pages. There are not a lot of us around. It's still new. It's not covered by insurance. It's probably going to take the baby boomers to get up in arms about something like that before they'll cover Medicare or something like that will cover that. So it's all private pay.
So would a physician refer you to someone or a
Yes.
patient to you?
Mm-hmm.
And how does someone find your business?
I do advertise a little bit, and I write a quarterly article for the Center Daily Times.
Okay.
And as I say, I teach in facilities and so on. Physicians can refer their families to me, and they have. And I also have my own website, so some people find me through the website because I have the ability to do conference calls nationwide with families. So distance doesn't matter. One family member could be in Florida, one could be in Ohio, and one could be in California, and I can talk to them all together at the same time.
That's terrific.
Mm-hmm.
Yeah. Well, we're going to take a call from Stephen in State College. Stephen, how are you tonight?
I'm fine. My question has to do with frankness and telling truth to people who have dementia at varying ages. I should think it would be important to tell the truth rather than kid them along that they are making repeated requests, for example.
Okay, well, Cindy, do you want to talk about truthfulness and laying it on the line?
This is a difficult thing for some families to get past because they don't want to tell what they define as lies. If you think about keeping this person with dementia, this loved one, in the most calm and happy and safe state that you can, okay? If that's your goal, and it's a great goal, then how do you achieve that? You can achieve that without ever lying to them, but you have to be really, really quick on your feet and able to think of ways around questions that they ask. And I'm not that quick on my feet oftentimes, so I tell often what I term a therapeutic fib. My goal is to keep this person calm and happy. For instance, if an 89-year-old woman asks me, "Excuse me, my mother was just here. Where is she? Where's my mother? I'm looking for her." And I know that her mother has been dead for 40 years. Is it helpful for me to gently remind her that her mother has been dead for 40 years? No, it's not, because one of two things will happen. She will either believe me and mourn her mother's loss all over again, and that's certainly not going to make her happy, or she will think I'm lying to her because she knows her mother was just here, she just saw her. So instead, I'm going to get in her reality. And I'm going to say, well, no, I haven't seen your mother. Can you tell me what she looks like? And then we start talking about her mother. Does your mother drive a car? What do you think your mother would make for supper tonight? And what I'm doing is I'm leading the conversation onto another topic. And hopefully she'll forget that she's actually looking for her. But in many instances, I'm not able to think that quickly, and I will tell a little white lie or a fib, a therapeutic fib, and say, yes, you know, you're going to be staying here overnight, and I believe you're going home tomorrow. Just so that they're more calm, they're more happy, because they're going to forget the conversation anyway.
That's great. You know, that's all the time we have tonight. I want to thank Cindy Keith and Jane Sheeter, my guests, for being with us. And I also want to thank all of you for the time you took to make your calls and comments. I hope you'll be here with me on March 6th when we'll be talking with Dr. Peter Roy about the causes and treatment for migraine headaches. For Penn State Public Broadcasting, I'm Chris Clark. Good night.
A copy of the program you've just seen can be purchased through Penn State Media Sales at mediasales.psu.edu or by calling 800-770-2111.